Beatrice is here. Controversies raging in the United States these days, of course, over whether the birth control pill should be covered by insurance and, well, bottom line, who should pay.
Yeah, but here in Canada, of course, the pill is available only through doctor's prescription B. And the question that some people are saying now, that's out of date, even paternalistic.
That's indeed what some people say. There are situations in which you can get the pill without a prescription, Canada, but that usually means going to a sexual health clinics. Now, some say the pill should be, however, as easily available as aspirin or condoms at the drugstore. Getting hold of one of these is pretty easy. Condoms are sold over the counter, but to get a birth control pill, you generally need a prescription. Some say the pill should be as easily available as aspirin or anything else you can get at the drugstore.
Everybody thinks of the pill as a risky thing, but when you look at overall risk of cancer, the pill prevents more cancers than it causes, if it causes any. The risk of blood clot, which people keeps mentioning, adds perhaps 3 to 5 episodes of blood clot per 10,000 women per year.
Though there may be benefits, there can also be risks to taking the pill. Recent lawsuits alleging harm, including strokes and gallstones, against the makers of Yaz and Yasmin demonstrate the potential for severe side effects. At the Hassle-Free Clinic, this counselor backs greater accessibility through affordability, for example, but not at the cost of safety.
We're able to sell most oral contraceptives to our patients for about $7 a package. If someone goes to a pharmacy to get that prescription filled, it can be $25 to $30 depending on the pill. So that's a huge barrier for people.
When it comes to access, some doctors acknowledge they could make it easier.
A number of physicians always tie their re-prescribing of birth control to a woman getting her pap smear, and I think that may be one of those barriers that we have to think about not putting up.
Some countries, including Mexico, already offer the pill over the counter, and some say it may be time for Canada to test the idea.
I would certainly be in favor of us looking at some trials to see what does happen. What happens to the use of the pill? Do patients continue to get the right pill? And what happens to pregnancy rates? And what happens to some of our very good safety parameters? We don't want to put those at risk.
Keep in mind, not all birth control pills are created equal. They have different combinations of estrogen and progesterone, or it may just be progestin, and they can all have different side effects. It's not uncommon for women to need to try 2 or 3 before they find the one that works best for them. And the risks for a woman in her 20s are different from those in their mid-30s and beyond. So it's definitely important to get some sort of advice if you're on that medication.
Okay, B. Thank you.
You're welcome.